Ayubowan, and a very good evening, ladies and gentlemen. Kindly be seated. It's my absolute privilege to welcome all of you all to the official launch of Healthsync, Sri Lanka's first patient-centric digital health record platform in Sri Lanka. Now, the moment you see these keywords on the digital screen, ladies and gentlemen, this itself signifies something very creative, a pivotal initiative, and something innovative they're about to unveil very shortly. But before that, we would like to invite our dignitaries to join us in lighting the traditional oil lamp, signifying a bright start and a resounding success of this event. To begin with, our Honorable Chief Guest, Professor Kavinda Jayasiri, our guest of honor, Dr. Dharmasiri Kumaratunga, Mr. Jayasankar Virasinghe, Dr. Rohantha Atukorala, Mr. Damian Ponvira, Mr. Rabindu Jayakodi, Mr. Felix Ponvira, and Mr. Malshan Runner-Waller to kindly join us in writing the traditional oil lamp. And this is a bright start where we come together to signify an event of amusement. Ladies and gentlemen, meanwhile, I see a few empty spaces, empty seatings. Could you kindly fill in it? This is a humble request. If you see a few empty spaces in front, maybe you all could come in front and we could fill in the gaps meanwhile. Thank you very much, gentlemen. You may take your seats. Today, we all gather here, we come together for something truly special. One step forward to redefining the future of healthcare in Sri Lanka. Something we all have been waiting for, a problem we all have genuinely been facing over the past few years, the decades, and today, for that much-needed problem, we have a solution which will be launched. This is more than just a platform, ladies and gentlemen. Healthsync is a secure, intelligent digital space designed bringing all your medical data, could be healthcare records, to one platform, to one particular place, which creates a unified journey of healthcare for each and every single individual. Something we all look for is convenience, anywhere, at any given time, not just in Sri Lanka, a platform we can access even internationally. And today, that's what we launch. Now, right at the start, you're about to very gradually hear the scope, the depth, and the necessity we all have towards Healthsync. But before that, for this great initiative, right at the start, please put your hands together, because this is how we start. The entire courage the team had, the confidence, the risk they took to come up with something people in Sri Lanka need, and that is, ladies and gentlemen, Healthsync. So please put your hands together right at the start for this great initiative we all have come together, and also very shortly we'll be launching. Now, to welcome all of you to this amazing evening, ladies and gentlemen, please put your hands together as I welcome to the stage the founding director of Accent Systems Private Limited, Mr. Malshan Runner-Waller. A big round of applause to him as he comes on stage to deliver the welcome speech.
Thank you, Vinay. Good evening, my dear ladies and gentlemen. Thank you all for being here with us this evening and for being a part of this important moment. I would like to warmly welcome all of you, including our chief guest, our guest of honor, the representatives of Ministry of Health and the Ministry of Digital Economy of Sri Lanka, members of the medical community, members of the business community, members of the academic community, and all of our distinguished guests. Digital transformation is shaping every industry. Healthcare is at a turning point in a global level. And in correspondence to that, Sri Lanka needs to develop a strong digital healthcare foundation. And Sri Lankan healthcare system should be ready for the next phase of technological evolution. Today is about enabling that next step that you require. We all know why we are here, but the Axon Systems team do not think of this as a mere product launch. This is the first milestone of a long journey. There's a growing need for more and more connected systems in the world. Therefore, Healthsync is a response to that moment that we are in right now. This event is about bringing public and private sectors together to align all stakeholders under one vision. So let's make this event a platform for collaboration, mutual support, and a shared vision, not only technology. Through Healthsync, we envision a Sri Lanka with a very sophisticated and efficient digital health infrastructure. And in the next 2 hours, you will see how this vision comes to life through Healthsync. So let's take this step forward together. Thank you very much.
Thank you very much, Mr. Ranavalla. As he mentioned, ladies and gentlemen, this is a growing need. This isn't just a one-off platform, but it's where all sectors come together, collaborate, partnership, and network, and that's where we move forward with this great initiative. Now, to most of you, you might have the question, or rather a question mark in mind. Why was Healthsync built? Well, now is a moment where all of you all will be addressed with what really Healthsync is. How is this possible? How is it relevant for you? How could you all move forward with Healthsync? And of course, indeed, it is how we redefine the healthcare sector in Sri Lanka as well. And no matter what, COVID can hit, a weather condition can hit, another Aragale can come. But irrespective of all of those, health is essential, and we all need the healthcare system, the healthcare ecosystem to be stronger day by day and move forward from strength to strength and growth to growth. All right, now let's hear how was Healthsync built. Now for that, I'm about to invite an eminent personality to the stage, but allow me to first introduce him to you. He is none other than Damien Ponvera, the co-founder and chief executive officer of Axon Systems Private Limited, the company behind Healthsync. Damien is a digital health professional with hands-on experience in implementing large-scale electronic medical record systems. He holds a master's degree in data science from the United Kingdom and bachelor's degree in business management. He is the driving force behind Healthsync, with a vision to build a patient-centric digital health ecosystem in Sri Lanka. Ladies and gentlemen, time for us to hear why we built Healthsync, from our most loved personality, an individual who has been the backbone to make sure this event was a true success. Please welcome on stage Mr. Damien Ponvera with a round of applause.
Good evening, ladies and gentlemen. My name is Damien Ponvera. I'm the co-founder and CEO of Axon Systems. I'm very excited to be here. So as Minal mentioned, let's talk about why we built this. What's the reason behind it? Arogya Paramalabha, and in English, health is the greatest wealth. Now, this is not a modern idea. It's been there for thousands of years. And it somehow connects wealth and health together. So obviously, let's talk about wealth. So for all of us, when we talk about wealth, your house, of course, your nice house that you live in or you are building, and your luxury car that you drive, your career, your job that you have been working so hard to build up, and your investments, number of shares you have in different companies, and your lands and deeds, so the list goes on. But now you must be wondering why there's a very ugly looking table at the bottom. Well, that table is your health. Now, all of this sits on this very fragile table. If the table breaks, nothing else matters. And on this slide, I want to highlight something that we often forget, which is we only get one body to go throughout this life. And we treat it sometimes as it's replaceable. On this slide, I want to pause for a moment and acknowledge something truly special. So when it comes to healthcare, Sri Lanka has something very unique. We as a country has a very well recognized universal free healthcare system. Most of the time, we don't appreciate it much. We see gaps, we see issues once in a while. But for a country like us in this region as a developing country to achieve this, it's great. But some of you might know, even developing countries don't have a free universal healthcare system in their countries. And of course, we do have our healthcare professional. They are world-class healthcare professional. We are lucky to have them. And we do have established, very widely established network of hospitals. And also, in very recent years, the government has been investing lots and lots of money and time into digital health initiatives. So as a company, we had the privilege to have a few discussions with the Ministry of Health. What they are doing right now is amazing and timely needed. So they are right now building the national EHR systems, and they have started rolling out, giving out PHN numbers to all the citizens. And my colleague Malchan will discuss more on this in his presentation. And also not just the government and the public sector, but we have noticed that even the private sector is investing lots of money into digital health initiatives. You must have seen now in hospitals, they have started giving out typed prescriptions. That's a one step forward for the digital infrastructure. And what we receive, the care we receive when we walk into a Sri Lankan hospital is second to none. Believe me when I say this, I live in Canada. That healthcare system is no match to Sri Lanka. We might not have the nicest looking hospitals. We might not have the greatest and the latest technology, but the care you receive is second to none. But with all this strength, we have one piece missing. And unfortunately, that's not a small piece. That's the piece that glues everything else in the system together. We don't have a way to manage patient records. And that's a huge gap in this system. So now we have hospitals. They keep their own records. I hope they do. And we have labs. They keep their own records about you. But where's the patient in all this? But the patient should be in the middle of all this. But unfortunately, in current situation in Sri Lanka, the patient has to carry all the papers with him or him. And then the patient becomes, all the data becomes fragmented and the patient is left out. So patient is not in the system. So this is the gap. The main gap is we don't have a patient-owned health record system in Sri Lanka. And I want to highlight something that I mentioned earlier. So you are responsible for your own health, not your doctor, not the government, not the doctor's office, of course, but you are responsible for your own health. Because remember, health is the greatest wealth. Let's look at the impact on a patient of not having a system to keep a track of all the medical records. I'm not going to go through all these points, don't worry. I'll hit one point. So in real life, we buy cabinets or organizers, to keep all our important documents, certificate, and deeds, everything organized. So the purpose is on a later date in the future, whenever we need, we can easily retrieve that. So that's the purpose of having a organizer, right? But in Sri Lanka today, with this current healthcare system, we, the patient, becomes the organizer. So unfortunately, we have to manage our own records, maybe 2 prescriptions in your wallet, 1 in the Google Drive, 1 in the iCloud, and some lab reports are in your WhatsApp chats. It's all fragmented. And something really bothers me is, in an emergency, the doctor that is treating you has no idea of your medical condition or what are the allergies you have and what are the medicines that you have been taking, the conditions you have, nothing. So nothing is there on the patient side right now. Oh, sorry about that. So let's look at the impact on doctors and as a nation. So majority of you are doctors here. I'm pretty sure you must be spending at least 5 to 10 minutes when a patient walks in to figure out that patient's history. You must be asking, are you on any medication? Do you have any allergies? Do you have any conditions? Do you have something that I should know of? And you shouldn't be forced to make decisions without seeing proper data from patient's end. And this is 2026. We talk about AI, but we still couldn't figure out a place to keep all our medical records, for doctors especially, to treat their patients. And if you think about the national level, imagine the number of millions and billions of rupees that we waste just for keeping making duplicate records just because we don't have a place to keep the medical records. Now, imagine when you walk into a doctor's office, the doctor knows everything about you. So this is not a science fiction. This is what we are building. This is what we have built. Because with Healthsync and with what we are building as an ecosystem, so the doctors and the healthcare providers will get that view that they are missing right now. So here on this side, we have the clinical data, because when you upload your health records into one centralized location, we can retrieve your most important clinical data. And then we can bring in wearable health devices. We can connect your wearable health devices into that platform, and then we can bring in all your activities, your sleep patterns, or your heart rates, ECGs, oxygen levels, everything. And when you go to the doctor, we can use AI insights we can use AI to give doctor a better idea of what he's dealing with. So the doctor has a clear view of the patient that he's treating. Doctor should not have make decisions without seeing the clear picture. So Sri Lankans deserve more. So as a country, as a nation, we have gone through a lot and we always push back. Now within Axon Systems, our goal is to give Sri Lankans the care they really deserve. And giving them the proper tools, the secure tools that they need to manage their health. And ladies and gentlemen, this is why we built what we built. Thank you.
Thank you very much, Mr. Damien Ponweaver. This is why we built what we built. What you see is what you believe as well, ladies and gentlemen. And now is that moment we all come to where we're about to unveil Healthsync. That moment, this is one of the key highlights of this evening as well. This is Sri Lanka's first patient-centric digital health record platform in Sri Lanka, ladies and gentlemen. This is not just an innovation. This is the transformation we need. This is the transformation our community needs. This is the transformation all demographics in Sri Lanka needs. Ladies and gentlemen, please draw your attention towards the screen as we unveil something truly special. And this is that moment we have come to. So please draw your attention towards the screen. Ladies and gentlemen, with a thunderous round of applause, we officially launched Healthsync, ensuring security, empowering patients to take control of their very own health records, medical data, making sure every step of the way is handled, every step of the way is consent-based sharing, and this is Healthsync. But something I noticed from the audience is you did not sound truly inspired. It's the vibe and sense I got. So one more time, can we give a thunderous round of applause? Because this is the beginning. Sri Lanka needs, this is the beginning we all have come to, irrespective of our industries. All right, ladies and gentlemen, now it's time for us to have more details and delve more into the presentations as well, where you will be highlighted about the platform in detail. But before that, I'm about to invite two individuals, but time for me to introduce them to you. The next individual we introduce on stage is Ravindu Jayakodi, the co-founder and chief technical officer of Axon Systems. He is a technology leader with experience in building scalable software platforms across global industries. He holds a master's degree in computer science from the University of Moratuwa, specializing in data science, and a bachelor's degree in computer science. He leads the technical vision and development of Healthsync, diving into the platforms towards becoming a secure, scalable, and patient-centric digital health ecosystem in Sri Lanka. Please put your hands together as I welcome on stage Ravindu, ladies and gentlemen. Also with Ravindu, may I invite Mr. Damien. Time for you all once again for another presentation, but this presentation is a little bit different, where they have a one-to-one conversation along with you about more details, especially about how document sharing, family profiles, AI-powered report analyzing happens, and this is something for you to draw your attention as to.
Hello, ladies and gentlemen. So, I think why you are wondering what Healthsync is. So, this system is being built in Sri Lanka for Sri Lankans. So, let's put our attention to Healthsync. What is Healthsync? The core idea behind Healthsync is it's a secure platform to manage your health data. So you must be wondering, what's the difference between Healthsync and another cloud-based storage solution? Is it another cloud-based storage solution? It's not. The reason is, it just not stores your data, it knows your data. So let's dive in, because we got a ton of features that we want to dive into.
Okay, so me and Ramidu have had lots of calls with so many users while we were collecting requirements, while we were building Healthsync. One of the main questions that we receiving actually, is what's the difference between this one with Healthsync and maybe Google Drive or iCloud or Dropbox or OneDrive? What's the difference? Is it just a place where I can store all the data? So while we were building, I used to use Google Drive as well to store all my health records, Sri Lankan health records actually. And then one of the issues that I faced with is that whenever I need them, there's no view for me. I should know exactly what where the folder I stored that. So we wanted to solve that problem. So ladies and gentlemen, that's why we implemented this timeline view, where you can see all your health records in a chronological order from the day you started putting it. So I would like to invite Ravindu to explain further.
Yes, so it's also very easy to retrieve your documents as well. You don't have to put a lot of data when you're uploading photos or any kind of document. You just have to take a snap, and our Healthsync AI will detect what kind of a document that is. And if you want to search faster, retrieve faster, you can of course add more details like the doctor name, the hospital name, and even you can set reminders. So we have a ton of comprehensive filters and search options, so you can easily retrieve them later whenever you want in just seconds.
So again, this feature, family member. And so I personally don't expect my mother and my father to use this platform because that's not fair. And as their elder son, it is my responsibility to take care of them, which means take care of their health. So I should have a view. I should be able to see their records with their consent, obviously. So we wanted to have this feature. This is one of the core features of Healthsync, where, let's say, assuming that my mother and father have created their Healthsync account, which I should help them create. And when I send an invite to my father will get a request from me saying that I would like to add him as a family member. So at the same time, he will see a consent document where it lists all the things that will happen the moment you hit approve. This is like sending a friend request on Facebook. And when my father accepts my request, I get to see his timeline. And I can upload documents for him. I can add all the doctors like names or tags to those documents and then manage and maintain the timeline or the documents for him using my Healthsync account. So that's the core idea behind this family member feature.
This is where it gets interesting. You might have been wondering, what's the AI part of this? So whenever you upload a document, if it is a lab report, Healthsync AI has the capability to understand that report. So Healthsync doesn't just store your report, it goes through each and every number and detail of that report, and it structure it in a way that the doctors will understand, and it will save it in your personal health history or your personal health profile. So this data, we are not using this data for anything else other than storing in your own health profile, which you can only access. So you must be wondering, what's the use of this for us? So we have set up a feature where you upload a lab report and Healthsync AI will give a very brief introduction or information of that interpretation of the report that you can understand. I'm sure you would have faced a situation where you get a lab report and you don't really understand what it means, what the numbers say. Don't worry, Healthsync AI will do it for you from now on with its AI capabilities.
Now, storing your document is something, but sharing those documents with the correct person is something else. So we wanted to add like 4 main features, and we will be adding more features in the future as well, to share those documents securely with the healthcare providers or whoever you want. Now, I'll go through the first 2. We have added this QR feature where you can generate a QR code based on your document, and then you can let it let that scanned by a doctor or somebody, some healthcare provider. And then with the QR code, it will generate a password. So that person should enter the password to view your document in a more secured way. Same goes with the link as well. So you can create a link and a password for your documents, and then that person, the other person should enter the link, and then the system will ask the password for it. So those are the 2 main secure ways of sharing documents using Healthsync.
And you have the good old ways too. You can just simply download the document as a PDF or even print the document. So you can carry it with you as a physical record. So you must be wondering, what's the catch here? There's no catch. So you can create a Healthsync account for free and use all of these core features without spending a cent. Yes, that's true. So we are giving a single profile and a document timeline with easy sharing and up to 2 family members with limited AI capabilities on the free platform. That will be enough for you for sure. If you want to handle your family's health records, you can buy our premium core platform, which is just $349 a month. That's just $11.50 a day. So you will be able to manage all your family's health records with AI capabilities as well. And if you want to go further and have Healthsync as your personal health assistant, basically, to manage even more family profiles and to get advanced health insights and early access to our newest features, you can subscribe to our Pro Health platform, which is $1,249 per month. So what are you waiting for? Just grab your phone and scan the QR code and register to Healthsync. It will just take 2 minutes of your time.
So this is your health data, and your control. Ladies and gentlemen, welcome to Healthsync. Please sign up. Thank you.
I actually only noticed 3 phones go up. Now I see 4, 5, 6. It's increasing. Let's give it a moment then. Maybe we can pull out our mobile phones from our handbags, our pockets, and take a minute. And why don't you experience Healthsync by your own self? And that's where you will also spread the word. Let's take a moment for it, ladies and gentlemen. After Mr. Damian's and Mr. Ravindu's one-to-one engaging session, if there are any questions, you're most welcome to ask them in person after the session is done. And now, ladies and gentlemen, we come to another presentation where you will be enlightened about the trust and compliance, how your data is secured. I'm sure you might have a big question there as well, and that's the time for us to clarify it to you. To conduct this presentation, I would love to invite on stage the founding director and the head of security and privacy at Axon Systems, Mr. Felix Ponvira. A distinguished chartered accountant and a seasoned professional, Mr. Ponvira brings over 45 years of experience in finance, audit, governance, and risk management. His deep expertise in compliance and financial oversight has been instrumental in shaping the robust, secure, and accountable systems. At Healthsync, he plays a pivotal role in ensuring that the platform is built on strong foundations of security, trust, and transparency, safeguarding what matters the most, people's health data. Ladies and gentlemen, please welcome to the stage Mr. Felix Ponvira.
Good evening, ladies and gentlemen. You may have little understanding about the product now by the time with these 2 presentations. So as a head of security, of course, it is my duty, and also it's a responsibility to explain how your data has properly recorded, as well as it is saved at our health system, our health system. So this is, I think this is all based on, this is a customer service point of view. The entire service is based on 3 components, 3 pillars. That is the the trust, security, and compliance. Trust, of course, it is your as a customer, from the service provider. So you have built up your own trust with us to join with us. Then, of course, the question arises: any of you, what type of security you will have for my data, my records, and about my personal records, my family records? Then, of course, in that point where we give you a confidence, and this confidence and in the link to the trust, that we are compliant with all the aspects that are related to the data and data protection, etc. So for that, right from the beginning, when Healthsync start talking about, that was the one of the main pillar next to that technical part, that we had to build that our compliance and the data protection, etc., parallelly with that IT related that system. So, ladies and gentlemen, so for that purpose, we have built it, and sorry. So the main concern of data protection is that we are, as a local body, we have to comply with our own Sri Lankan rules and regulation, where the data are related. And of course, all of you know about the very recent controversial act, that Sri Lanka Personal Data Protection Act launched in 2025, where it is by virtue that it is all the personal data are secured under any circumstances, etc. So for that is the Personal Data Protection Act is our premier legal obligation and our closest commitment. So where we started our work on this as personal PDPA. And for that, you can see that we have appointed data protection officer. And also, all the highlighted area only measured that data are collected explicitly inform, and it is consent. And some of the areas that related to the inscription, that with role-based access, all are controlled in technical point of view, and access, and the ratification, and also it is ensure that everything is supported with the legal requirement. So PDPA has some principles, 7 principles that it is listed there. We have already followed all the principles that when we built this health system and compliance point of view. Then of course the next part, of course, we didn't stay with the local regulations and the local requirement, and all of us, like our CEO mentioned, that our healthcare system is none other than to the that any country. I mean, our system is well equipped and with the recognition of the health services. So we went to that GDPR is a European Union that they follow the data protection that we also apply for that for our product as well, and there also the individual right well supported. I mean, with the 7 rights which we mentioned there. So in that case, we consider that also it's a part of our compliance, and all the measurement, all the steps and all measurements has been taken to safeguard the data, and purely for that it is owned by the customer, and under any circumstances that even for our system database administrators cannot see all data because it is fully under your control. In there, we ask for that explicit consent once again. Users actively, they have to give they can have the data with us, and also they can withdraw it at any time. Then zero knowledge of architecture mean in the last right corner, that mean it is well understanding, because from our side we have no idea exactly what you are stored, and from your side that it is well defined there. Then of course right to be forgotten. That means if you have decided that if you want to leave, that it is your own, you can leave, you can delete your data your own, or otherwise you can request the Healthsync to delete the data. Then of course there is a system way that we can do it, but only thing is without seeing any of the data. And data portability, of course, it is one of the privilege that the GDPR has already entrusted, that your data can carry with you at any time, anywhere in the world, and you can use it for the health service, for the doctors, and as well as the health service providers. This is the next move. Of course, it is that we didn't stop with the European Union Protection Act. Then again, this is the internationally recognized HIPAA, that United States Health Data Standards, that any of the data protections compliance, of course, it is most of the all organizations in the world, of course, with the data that they comply, they use this HIPAA as a standard for their data protection. Then, of course, it is the different version, but it is same manner that data protection, of course, it is mentioned that they follow in there. Of course, you can see encryptions, access control, and audit and governance, and also the breach notification, etc. there. So in there, of course, it is the most important task, though the local system and the previous one, though they are firmly well established the access control and audit and other governance, etc. In this HIPAA, it is very entrusted, very well defined that what to follow, and we have already follow for that access control every step, that different level, all access controls are already established, and every step that audit trail back like in a back office in a bank, so you can have the audit trail very well, that we can see it, your all movements, and under any circumstances that it is, we can retrieve that the action, that means the audit and governance part. So that is the way that we mentioned, we already follow, but at this stage now, of course, it is, we still need to go further. As we grow further and we have some independent validation, it is our responsibility, and because by launching that, we cannot say that we comply it every all aspects. So we have already taken the step with CERT, that is Sri Lanka Computer Emergency and Readiness Team, that we have already had that dialogues with them and with the meeting with them to validate or to endorse our system is secure all aspects, A to Z, all aspects, and that steps has already taken. It will take little time. That means that we have to launch the system, and then we have to go we invite them and face to face, that they have to have some testing system. Then in there we have to work with them. So that is the CERT compliance part. So that you can see, in addition to that, we work further to have two types of certification, that is SOC2 type 2 audit, that is more or less, it is the, of course, it is USA certification. Actually, this certification is more related with the, it is introduced by AICPA, that American Institute of Certified Public Accountants. That is that the independent auditor, in the technical point of view, that independent auditor thoroughly checks that A to C of our system, and we get the certification from them that we have already complied, and we met all the requirement required for the data protection in terms of the customer point of view. The next is, of course, ISO 2001 certification. That is also another part that you can see. It is most of the, data protection side, data side, that we have to have that certification. That is also a part of our ongoing effort to have the safest place to the for your data and your family data, etc. So this is the part that we have mentioned, we have already done. So now you can see that we didn't build health system simply click just only compliance boxes, but we have a continued process and continue that timeline and all the steps to taken, and all these steps that anyone, any third party, any outsider can see how our data or my data are protected under Healthsync system, and we work on that tirelessly. It's our responsibility, and that's a part that's our responsibility. So our commitment is ongoing, and Healthsync will continue to raise the bar. Thank you. Please take it. Thank you.
Trust, security, and compliance. Thank you very much, Mr. Felix Ponvira, for taking the time to also explain the details about the compliance related to Healthsync. Right at the start, something I did mention was, today we all have come one step ahead, one step forward in redefining the future of healthcare in Sri Lanka. And now it's the time for us to also understand the future vision of Axon Systems. Now, to enlighten all of us about the future vision of Axon Systems Private Limited, I'm about to invite a person all of you all can see around, but he is one individual who has been behind this initiative, making sure start to the end, every performance, every program was in line. He is Malshan Ranavalla, the founding director of Axon Systems. Malshan is a project management professional with experience in software development and digital platforms. He holds an MBA from the United Kingdom and a bachelor's degree in electronic and telecommunications engineering. At Healthsync, he plays a key role in business strategy and partnership, ensuring the successful execution of the platform. Please welcome to the stage Mr. Malshan Ranavalla, the future vision of Axon Systems to be enlightened to all of you.
Thank you, Minal. Good evening again, ladies and gentlemen. Yeah, so you might have wondered, so you have now seen what Healthsync is and what Healthsync can do. So you might have wondered, is that it? What's next? What else can Healthsync do? So I assure you that this is just the beginning and there's a lot coming in the future. So I'll move a bit here. So the immediate next steps, or the features that we are hoping to integrate for Healthsync in the very short period of time that is upcoming are these four features. The first one is immunization support, which is providing where you can see a very comprehensive vaccination history and especially schedules for the upcoming schedules, vaccination schedules for you and your family. And second one, laboratory and pharmacy integration. So I think this is one of the key features, like key concepts that we integrated into Healthsync when we envisioned this platform, because in a field like healthcare, we can't sit in silos. We can't sit in our own isolated rooms and make this system work. The core concept of Healthsync, one of the core concepts of Healthsync is synergy, working together, because being separated from one another does not help us achieve this goal. So integrations like laboratories and pharmacies and many other institutes, health institutes, it's vital for the success for this platform. And the third one, allergy and chronic illness storage. So I think Mr. Damien also mentioned this part earlier, so I'll reiterate it, because we have heard of many stories that in emergency situations and in ICUs, the lack of knowledge about allergies and chronic illnesses or long-term conditions, long-term health conditions can be very critical in a life and death situation. So if we can build a platform where once a patient is submitted to a hospital in an emergency situation, if the doctors and the hospital system can see his or her main allergies and long-term illness, long-term health conditions, I think we would be able to save many lives every year. And the personal health journal, where we can log symptoms and daily vitals of the users. Especially for this part, we are hoping to integrate the wearable devices usage as well. Let's move on. Yeah, so one more thing. We are not hoping to stop at the patient level, because that is only one part of the system or the one part of the solution. But we are hoping to dive into and enable the doctors or private practices as well. And we have planned our next product, DocSync, which is a clinical platform, which is also a SaaS platform where which you can very easily integrate into your systems. So this is where the doctors and the institutes come in. And I think before we dive deep into Healthsync's future vision, I think we have to first understand the big picture or the bird's eye view. For that, I will first move on, first explain the Ministry of Health is undertaking many digital health infrastructure based initiatives and in the recent years. In 2023, the Ministry of Health published the National Digital Health Blueprint, which is actually the basis that we built this Healthsync platform on, and our vision. That's what we based our vision on. So the first point is National EHR rollout, National Electronic Health Records rollout, which is basically building a national level electronic health record system where the NEHR is storing all the health records, all the health information of all the citizens of Sri Lanka. And PHN, the personal health number, a personal unique health ID will be given to each and every individual according to the Ministry of Health's vision, which actually enables a very good longitudinal analysis of a person's health. And the digital health investments. In the recent years, both the public and private sectors have invested a tremendous amount in the digitalization of healthcare. So, how do we place ourselves in this vision? So, in the first part, you see the public sector or the national EHR, where there's the centralized data is stored of the patients. And the second one, the clinical layer, the middle layer between the public, like national EHR and the patient. And there we have placed our DocSync application, which we are rolling out in the coming few months. And third, the patient layer. That's where Healthsync app comes in. And that's where we enable the patient's ability to manage their own records in a very intelligent and robust manner. So, what is Healthsync's part in the national digital health journey? Even though the Sri Lankan Ministry of Health is ongoing on the national level transformation, this kind of transformation, national level transformation, does not happen overnight. It takes a considerable amount of effort and a considerable amount of time. So, but by the time that this national EHR platform is built and deployed, will the community be ready? Would we be ready? So that's where digital Healthsync comes in. So through Healthsync, we are hoping to lead the national digital health literacy transformation, so that when the public system is coming to the relevant standard, the community is also ready to receive the maximum benefit of that vision. So our primary goal for Healthsync product is becoming the premier personal healthcare application in Sri Lanka. This will not be an easy journey, and it will take a lot of time. So that's why we are inviting you all, our stakeholders, to join with us to take this bold step forward. Thank you very much.
Thank you very much, Mr. Malshan Ranavalda, the founding director of Axon Systems. Up next, ladies and gentlemen, I'm absolutely delighted to invite our honorable chief guest this evening. He is none other than Professor Kavinda Dayasiri. He is a pediatric at the Faculty of Medicine at the University of Kelaniya, and he is a consultant pediatrician at Ragama Teaching Hospital. Professor Dayasiri is an accomplished academic with extensive experience in child health, clinical research, and medical education. He holds multiple internationally recognized qualifications, including MRC-PCH and FRC-PCH. He has made significant contributions to advancing pediatric care and medical education in Sri Lanka. With a big round of applause, please welcome to the stage our honorable chief guest this evening, ladies and gentlemen, Professor Kavinda Dayasiri.
Thank you very much for the kind words of introduction. And first of all, I would like to thank Mr. Felix Panveer for kindly sending me an invitation to be the chief guest on this very important occasion. A few weeks ago, I and Mr. Panveer got to know with each other last year when I invited him to, kind of donate to our hospital, our ward, a set of patient files. Again, that is to store medical records in printed versions in a more convenient way. And I would like to thank him. I think that there was a group of team came from the Rotary Club to our ward with no hesitation in quick time, and we still use them, and they are very useful. But today, I'm here not to talk about the paperwork, but the electronic documentation. So this is one of the very, very important initiatives if we look at the future of healthcare in our country. There are a few things I would like to say at this time. First of all, when it comes to patient safety, electronic recording matters. I'll tell you a few examples. Now, we did a study last year, and we published it this year in one of the British medical journals, collecting data of the prescriptions done by doctors around the country. So you might know how the prescription's done, right? But there is a clear guideline given by the World Health Organization about the prescription standards. And we collected about 7 provinces. We collected data from 7 provinces. And if you're aware, some of the hospitals, mainly in few private hospitals, they do some electronic prescriptions as well. Government hospitals, as far as I know, there are electronic recording systems, like data in very brief. Data recording systems are there, but as far as I know, there's no electronic prescriptions being made or personal health numbers being used as of now. So what we found is, like, even though this quantity was less, we had about 100 electronic prescriptions. They had a significantly improved quality, as well as the dosing, because in kind of when you have to kind of type and then give a printed version to the patients, always doctors kind of look, think twice, like whether you're doing it in the correct way, right? So in that way, you can, we saw significantly less number of errors, as well as these prescriptions were more complete. So I believe it's not just the case with prescriptions, but also with everything, right? If you practiced in the electronic format, it's going to be very helpful. So this is a very, I heard that you're going to implement this as your second stage, DocSync, where you're going to introduce this to doctors and the healthcare institutions. So in that way, I hope we'll be able to improve the health safety and health quality. And also, we see, Mr. Felix knows me. I run with one of my teams who all volunteer. We run a digital poison center to the country. Right? So we get calls. Even now, I'm on call today. I got a call from Puttlam Hospital. Right? So whenever they get a poison child, like kind of, they get a child who eats something poisonous, maybe an overdose of medication, right? Overdose of something. So you kind of, because the doctors are less trained in managing specific poisonings, because it's not taught like in detail compared to other subjects. So they tend to call us. So some of these calls are related to medication poisonings, pharmaceutical poisonings. And we see they happen not just randomly. It is due to sometimes an error dose given by the pharmacist. Sometimes it's an error dose given by one of the grandparents, right? So, what we learn is like, you have to be very careful about, what is being written. So this, little things can really matter. So it's very important, to have, this type of a system in our healthcare. And not just it's about health safety. Sometimes now, when, because I'm a pediatrician, I would like to talk more about children. So if, when children grow up and then they go to care by the physicians, so you are going to see a completely different set of healthcare teams. So it is quite hard, kind of this transition period without things being documented. Sometimes a patient may have about 10 books, sometimes you miss, sometimes the parents say, okay, it was washed away in floods sometimes. Sometimes you lose it, some you can't find it. So it's very important so that, like it practiced in other countries, like, most of the developed countries, if you go to UK, Canada, or USA, you have, all these electronic services for patients, which is very convenient. And then you can look up the system and find everything in quick time. So in that sense, it is again very important. And the other thing is like kind of when health professionals, when we start doing some kind of a quality improvement project, it's very important, we have things like that. If you want to see how many, how many cases that we have managed, what we currently do is we kind of go to the record room and then we have a lot of files kept everywhere, all over, right? Even the people even the staff who look after these files, they cannot trace. But now we see like, like you told, Health Ministry is moving into a standardized electronic recording system so that the essential data can be seen in the records, like electronic records. So it is very good in all these aspects. It's very good that we have electronic system, healthcare recording system. And I see a few challenges as well. Now, there may be a bit of resistance when you try to implement this, especially, our people are quite intelligent, our people are educated. Like if you see how many parents or maybe, individuals know how to use WhatsApp, I think 90% will know, except, grandparents. Everybody else will know how to use WhatsApp. So they are quite, and they might watch YouTube as well. Right? But when it comes to things like that, sometimes they might be a bit hesitant. So you might have to go to the public and then give this message. And then I'm sure you will make it in a very user-friendly way, so that they can easily use it. And the other factor, I think, is the cost. I'm sure you will do it great as well, right? It has to be affordable. So if you want to popularize something among many people, so it has to be a affordable one, right? I'll tell you an example now. One of my colleagues in Edinburgh University, now they're making a chip, kind of a test kit to detect paracetamol poisoning early, right? So our country doesn't have a lab test at the moment available in the government, or maybe in one or two private sector, but not elsewhere. Blood test, but it's costly. It's about 10,000 rupees per test. So it is largely limited. When the prices are high, then people will not use it. So what they do is it's a very expensive test, but I think they are doing some refining thing, and then they are coming down in the cost. So when I asked what's the price of that is, they said $1. So if it's $1, they can easily market it in the South Asian region. So likewise, I think it has to be affordable. So this is a very remarkable, great initiative. I wish the team all the very best with what you do with this great initiative. Thank you.
Thank you very much, Professor Kavinda Dayasiri, for sharing your experience, plus well wishes to the team as well. All right, ladies and gentlemen, up next we have a panel discussion lined up just for you on a very interesting topic: building a patient-centric healthcare ecosystem in Sri Lanka from vision to reality. I will reiterate on the topic: building a patient-centric healthcare ecosystem in Sri Lanka from vision to reality. Now, this session will be moderated by me, Ambinal Pereira, and I'm about to invite our eminent personalities, our panelists, on stage for it. To begin with, our first panelist who will join us on stage, Mr. Jayasangha Veerasinghe. Mr. Jayasangha Veerasinghe is a product quality engineering lead at OpenMRS, a globally recognized open source digital health platform. He has played a key role in improving system reliability, interoperability, and developer ecosystem across international healthcare implementations. With strong experience in global digital health initiatives, he brings value insights into building scalable and connected healthcare systems. Our next panelist for the day, Mr. Damien Ponvira. He is the co-founder and CEO of Axon Systems, the company behind Healthsync. With experience in large-scale digital health system implementation, he brings a strong focus on building patient-centric and interoperable health solutions. He is he believes in leading the vision to create a connected digital health ecosystem that improves accessibility and continuity of care. And we have two more panelists to be introduced to you. Our third panelist this evening, Dr. Dharmasiri Kumaratunga. He is also our guest of honor this evening. He is a highly respected leader in Sri Lanka's digital transformation landscape with over 35 years of experience in banking, technology and public sector innovation. He has served as the Secretary to the Ministry of Technology and Assistant Governor of the Central Bank of Sri Lanka, and as Chairman of both the Telecommunications Regulatory Commission and the Information and Communication Technology Agency of Sri Lanka, which is also known as ICTA. He continues to contribute to national and regional digital transformations through advisory and leadership roles across multiple organizations. And joining us on stage, our final panelist this evening, Dr. Rohantha Atukorala. He's a distinguished business leader with extensive experience across global multinationals, national institutions, and international organizations. With over 2 decades at companies such as Unilever, he has held leadership roles in brand marketing and country management. He has also served Sri Lanka as chairman of the Export Development Board and Sri Lanka Tourism, and worked with the United Nations, where his project received global recognition. He currently serves as vice chairman of the World Rural Tourism Council and continues to contribute to strategic initiatives across the region. Ladies and gentlemen, please put your hands together as our 4 panelists arrive on stage. This panel discussion, ladies and gentlemen, will share expertise, knowledge, experience, insights, and perspectives from technology, policy, and healthcare to discuss the future of digital healthcare in Sri Lanka. All right. Now, I did not expect to be seated right in the middle of everyone, but that's okay. Spontaneous moments truly make the best as well. Now, in this panel discussion, ladies and gentlemen, we have these individuals representing diverse and dynamic sectors who will take you through with their personal experience as well. And ladies and gentlemen, this is not to only endorse, but to share the essential needs when it comes to vision and reality especially. All right, now the first question is an open question to all our panelists as well. The first question is, especially speaking about today's society in Sri Lanka, there is a fragmented society, there's a fragmented perspective among everyone, with hospitals, labs, and clinics operating in silos. From your perspective, what is the single biggest gap preventing us from becoming truly patient-centric? I will highlight on the keyword, what is the single biggest gap preventing us from becoming truly patient-centric? Anyone could go first. This happens in school as well. We always tap our friends on the shoulder and be like, you go first. Now, gentlemen, would you like to start? Thank you very much.
So I'll give you a short answer. It would be, I think, the one of the significant gap issues is that record doesn't follow patients. So that's the main issue here, and I don't see it as a technical issue, but it's more into a kind of a mindset issue. So,
and Damien, would you like to go next?
Yep, I completely agree with Jayasankar, and he's been leading OpenMRS, which is one of the world's very well-known open source healthcare EMR systems. As he mentioned, that accessibility could play a major role in being patient-centric. I think that's one of the keys. So in Sri Lanka, we would need more patient-centric systems and more systems to come, so that the patients have that accessibility to their patient records.
Thank you very much. And
first of all, I want to thank inviting and also congratulate for the young team having a new system. In my opinion is that mainly the trust having with the people. So if you are not having any trust for the system, then it will not success. And also the reliability. So that's also very important, especially for the IT system. Trust, reliability, and also speedy for the given the reply very quickly. That's also very important, and also the security. So those are the major things I have identified.
And Dr. Rohantha?
See, I think there is multiple issues. The first is that the question of whether you're data driven in your decision making, and if you go to most of our public hospitals, you tend to have a very high traffic, and when you cannot be absolutely data driven because of the kind of costs related to it. So because of that, you see that decisions are taken mainly on the experience curve. But with more lawsuits coming on play now, doctors are also saying, I need to see the data and should be data driven. They want to understand a person's backdrop over a period of time to see what kind of family backgrounds, what kind of diseases you have, so that then it has implications. So it's just going to be only a matter of time that data becomes absolutely centric for patient handling and patient care.
Thank you very much. Now, we also would like to start off entering to this panel discussion, understanding the global perspective. So this question is directed to Mr. Jayasankar. So you've worked quite a lot, especially based on your experience as well. You work quite a lot, very closely with global platforms like OpenMRS. In countries where connected healthcare systems have been successfully implemented, and in that opinion, what are the key benefits you've been through, you have seen, both for patient and the healthcare providers, in your experience and opinion?
Yeah, thanks. So I've been working with OpenMRS with countries like Rwanda, Uganda, Kenya, and one of the major changes I've seen is that it's something simple. Patient doesn't carry their medical history in polythene bags. So in previous presentation, we heard a lot the word fragmented, right? In a fragmented systems, who's the integration layer? So because patient is the integration layer. There are a lot of systems here and there. Like, we are the people who's trying to connect all the information. Remember the last time you became sick and you went to the GP. So they gave you a prescription, and then you took that prescription, and maybe you went to a lab and they gave you a report. Then you went to a specialist and you retell the whole story again. I know this happens every time, right? So
And sometimes they miss half the points as well because they don't know the medical background to it.
Absolutely, yeah. So and so this happens a lot in fragmented system, but in a well-defined system, they have solved it. So as an example, in Kenya, they have a network, they use OpenMRS, and they have a network called Empath, where they have over 1 million HIV patients. They have a centric system where all the records are shared among all the clinics around the country. And when a patient goes from a clinic in a village to Nairobi, do they just start over? No, they just continue the treatment. So, and also this, so to answer your question, and that's the benefit for the patients, and also for the doctors. They see the full picture. Once you have all the medical history in one place, they see the full picture. So you can, it's easier for them, and it's very safe. It becomes safer to make decision, and also it saves time uh, as mentioned in the previous speech as well. So yeah, it helps a lot. And honestly, the major one is the dignity. The patient doesn't feel like they are managing the system anymore. So, and they already have to manage their illness. Like they don't want to manage these system on top of that. So dignity, that's the one of the most important one I've seen in these systems.
Thank you very much for sharing the global perspective. Now, we move on to our next question, and this goes out to Dr. Rohantha. Now, we move on to the market adaptation and positioning. I'm sure you might have a lot of opinions to share on this, but this will go with the most prioritized opinion you could share. From a market perspective, what does it take to successfully position and scale a solution like digital healthcare in a country like Sri Lanka? What adaptation and how would we position it in our market?
Well, tough one.
Very tough question. That's why I said
Okay.
many things to say, but let's go with the prioritized one.
See, it's like this. We know that medicine right now is expensive. And from what we hear in the media, we see that people are said, you got to go out there, buy your medicine, or they will give the prescription and say you need to go outside and buy the medicine, So, because, money is scarce in the health sector also. So, given this backdrop, we know that data is going to be key in terms of the kind of medication that you give. So, I think in terms of positioning a typical product like this, it's all about being impactful and, of course, saving money. So these are the two key attributes by which you will position the brand. So if you take a matrix, you know that you're going to say save money and get impactful medication. So that's the kind of strategy that you will impart. Now, about 3 weeks back, there was a Indian company who approached me, and very interesting, in Hyderabad. They do this whole thing of telemedicine. So he has apparatus where you go and within like 5 to 7 minutes, you can check all your vitals. So you go to a village, you place this, and then they will have a series of simulations which you do. They pick up the vitals, and then those vitals are transferred to a set of doctors who are in Colombo. And the doctors will give the kind of what the medication should be. So they're just test marketed in Hyderabad, and now they are extending it across. All the top hospital brands have picked it up. And without, I don't know whether there is consent personally, because in the lower rungs of the socioeconomic classifications, your ability of data privacy, and you need to get consent to get this data. Without their knowledge, this information starts gathering, and then it's out there at the back end. So the product is already in adoption state in India. I'm talking about rural India. I'm not talking about the 400 million people who are all in the A and B SEC groups of India. That's not what I'm saying. So what they say is that it's all about impactful medication, saving on cost. And that positioning is working. So I suppose taking that as a benchmark, that could be kind of replicated as a strategy in Sri Lanka also.
Currently, have you seen it happening to an extent, or it should be completely started from zero?
Well, from what we saw, it's working. So now the question is, they are looking for a Sri Lankan partner here. And they came to the last time Sri Lanka Medical Administrators Association evening forum, actually, must say about 2 weeks back. So I invited them to come and make the presentation, and the interest that I saw from the fraternity, it just shows that people are having this at the top of the mind, and they believe that in the lowest rungs of societies where the gap is there in data, and there's appetite, I think, for a product of that nature, which means that it's good for the industry.
Absolutely. Thank you very much for taking us through the adaptation of Sri Lanka and how we can position things as well. Now we move on to government initiatives, which is a key point as well. And this goes out to Dr. Dharmasri. Based on your experience in leading national digital initiatives, what are the key challenges in implementing large-scale digital systems in Sri Lanka, and how can they be addressed effectively?
As now I am not in the government sector, I can speak, give some, the background on
Openly
that.
and freely.
Major problem what I identified is that introducing a new system is not easy. It's not even in government sector, but for the other sectors also. Maybe people will not grab or capture that one. Even though we have introduced Lanka QR, that's my initiative in 2018 to Sri Lanka. At that time, India, RBI, that's Central Bank of India, RBI, was introduced 2018. We introduced in 2018 October. And Singapore is also 2018. So with that, the same year, even though we have introduced the Lanka, the QR, SG QR for the Singapore and another QR for the India. So adaptation is very, very low, especially maybe awareness. But go to India, everywhere, you may not be able to use your card in most cases. So there are plenty of the shops, small shops, even in the small boutique or the outside small shop or tea center maybe. So they are using the QR code, but in our case, not adapting at all, but few people are using for the QR. And we introduced the same thing for the highways in 2020 maybe. So I think very few people are using that one. And now recently with this new government introduced the card-based payments in the highways. That's also not much using, but I think I have seen that yesterday also they are using the cash. In exit point, they are using the cash. No QR, no card, maybe mostly I think this crowd is using. So that is because mainly the awareness is not having much more awareness, and from the government side also know a lot for this one, and also from the regulator side. Regulator maybe the central bank or the insurance body or many other, or CAC. So that regulators also need to be push or drive this one with the government. So only government cannot drive this agenda, digital agenda, but others also need to be linked with that one. And in some cases, the interoperability should be there anyway. Without having the interoperability, we may not be able to use that one. In that case, I am having the payment app with the HNB. Then I have to pay for the QR code for the commercial banks. That's the interoperability that should be there. Without having, you may not be able to achieve anything. So 100% is achievable or interoperable at the beginning in 2018. So that's one. And also speedy recovery and the trust and the security side, you have to be 100% have the secure side. If not, no one is using. If a one or transaction gone somewhere else, then you may not be able to use that one. And also most of the government institutions at present, in my experience, ministries, they are working individually, silos. So they have the separate system and they may not be able to share their data. Even in the digital ministry, you may not be able to get the data from the other ministries, not sharing. That's also there. We introduce a IDAT system, that's agriculture sharing data. with the Agriculture Department, Ministry of Agriculture, and also the Fisheries Ministry and some other ministries. I may not be able to recall. But problem is that sharing data through the ministry is also not easy. So that has to be, I think, strong leadership should be there. That's the main thing, strong leadership. And introducing of the digital ID, that's a one area. I think how many years we are talking this one? Last 10 to 15 years we are talking about the digital ID, not success. During my time, I got the cabinet approval. So when I was as a secretary, then now new government is running that one. So it's happy to see that one. And so there are many implications inside this tender document and so on. I don't want to highlight that area. You will realize from the newspapers later. And also the government payment system like a GovPay and so on. During my time, I have started the new government launch. That's good. That's someone has launched. That's good. And what I want to give the news is that you have to carry on. Whatever the government come, I think it's better to carry on the same work. If it is a good work, you have to carry on the work and achieve. If not, if the changing of the government or the institution, then of course all the people change it. You don't want to stop. If it is a good thing for the country, you have to, I think, continue the process. There are many things I can say, but I will stop here.
Thank you very much, Dr. Dharmasri. Now, you mentioned one keyword, which is interoperability. The next question is directed to Mr. Jayasankar. Now, when healthcare systems are truly interoperable and connected, what kind of impact does it create in real-world settings in terms of efficiency, patient outcomes, and overall healthcare experiences?
Before moving to that question, I need to confirm what Dr. Said about that QR payments in India. I wanted to like travel in India, especially in rural areas, for like 1.5 months. So I was like, okay, I need to like I'll be there for 1.5 months, so I need a bunch of cash. So I converted rupees into Indian rupees, and I had a terrible time with paying with notes in India. They are so hesitant to accept cash. So yeah, moving to the question, I really don't like the word interoperability because it sounds like a kind of a word that only tech guys understand.
Any other synonym you could give for it?
But yeah, because like it sounds too technical. But but yeah, it's simple. So think it like this: you went to the lab and took a blood report, maybe. So at the moment you took it, when the results is available, the doctor who orders it just simply see it. Right patient, right context. That's it. That's interoperability. Sounds simple, right? But I mean, that's one of the hardest problems that we are trying to solve in digital health. But when it works, there are like many benefits of the interoperability. I would say 2, maybe 3. Okay. The most important one is the time, because now doctors don't have to chase reports. Like calling other hospitals, maybe waiting for the patient, waiting until the report arrives. So maybe they don't have to spend time on that. It will just appear on your system. So that time, where that time goes back to the patient. And the second one would be safety. Remember the time you had to admit one of your family members to a hospital. When the doctor asks a question like, what are the medications that she's on? And you was like, I don't know, because no one knows the full list, right? So once you have a system like integrated like everywhere, then like that's not a problem anymore. And the final one would be the transitions, because I think you may agree with this one. Most dangerous stuff doesn't happen on the treatments, during the treatments, but more into transitions. Like it could be like referring to another doctor, or maybe just like admitting to a different hospital, or maybe an emergency situation. once you don't have the full context of the patient, like then things become problematic. So I think those are the stuff I see the benefits of the interoperability. Yeah. So I think like that's where the like system like Healthsync actually like comes into the picture. So
Thank you very much, Jayasanka. And adding to that, I think most of the time we can also relate to that. Keep our family members aside. If we ask our health history over the past 1 year, 365 days, I can vouch we don't remember half of it. So, I mean, to do some justice to ourselves, I think we need to have our own record systems, which most of the time, especially on our medical related matters, we forget and we do not take it serious. So that was just adding to what you said as well. All right, next question goes out to Dr. Dharmashree. Now, with your experience as well, there's a lot of challenges that could be seen. But speaking about adaptation, how can challenges be adapted is the next question we highlight upon. As we move forward, more patient-centric systems will come forward. How important is trust in driving adaptation, and what needs to be done to build confidence among the public when it comes to sharing and using their health data? What adaptation challenge perspective can you bring to it?
So I will speak not limited to the health data. It's a normal system. Then I think this crowd, I think young innovators, they can adapt something. Number one is that this is the customer data and the citizens data you are getting. Then you have to be adhere to the Data Protection Act 2022, and you have to register that on DPA. Data Protection Authorities there, and to be directly linked with that. That's the number one. And also the system trust should be there. If it is the reliable system and the citizen can trust the system, then of course you may be able to use that one. Without having any trust, then it's a zero adaptations, and they have to be very careful. And third one is that where this data is going to kept. It's a cloud or the server base or whatever. It's a cloud is more secure than the server base. There are, I think, pros and cons are there, but you can argue. The thing is that it's a domestic cloud, or the boundary should be considered on that one. So there's a cloud system having the government cloud is also there. Then you have to be considered on that one. And also the most of these government entities, even though Ministry of Technology is there, they are providing the cloud, national cloud system for all the ministries, but ministry-wise, they have gone for another cloud. So that's also there, but you have to think on that one, which cloud you are going to select, which area where you have to protect the data, especially for the customer data, citizens data. If it is going to kept outside, according to my understanding, the financial transaction data should be within the boundary. You may not be able to allow that financial transaction data kept in the outside cloud, outside the boundary. That's from the central bank side. So therefore, you have to be very reliable and careful when you are working with this citizen data, especially for the digital ID comes. I think a lot of arguments came for the digital ID. That data is going to have kept in India. So that's not the true, but you have to be very careful. And also when you're introducing the system, please get certification of the SL cert, as I said earlier, or any other entity. For the payment system app, which introduced by the banks or the other financial institution, there's a regulation came from the central bank. I have issued that one at that time. You have to be certified for the third-party auditor, not from the bank itself. You have to be certified from the third-party auditor. Every year you have to get the certification from the third-party auditor, then has to be certified, get the board approval, and informed to the central bank. So that's the way it has control. So likewise, when you're introducing something, especially for the customer data or the payment system or whatever, has to be audited somebody. SL cert is also the institution, government institution under the Ministry of Technology. That's also there, but there are many other private institutions. You can get the certification from them. So there's another proposal from my side. and also gone to the people not to charge anything at the first level. You show some of the prices here, not good to take the apps of the people. To attract the people, first give it free of charge and excise from the people and use it. Then of course you may be able to get some nominal amount from the people. If not, no one want to get that. Adaptation will be very low. One example I can say is a pay here. You may heard that one, pay here, Helakuru or something. He gives a free of charge at that time. The central bank side, we give the approval for him to go for that. Then no charges at the beginning. Now it's more than 600,000 customers are there. Now they may be able to charge something for the different. The way of catching of the people is a different way you can do it. So there are few items I have noted down when you are doing this presentation. And also language barrier. So language barrier that should be what from the central bank side, what you have informed to all the banks. If you are creating the app or deploying the app, you have to have the 3 languages at present. Then of course I know this fully the technically this is not easy for the having this the health record in all in single, but to use to enter in or registration of this app, you need to have the other languages also. You can use that. So and also customer consent is very much, I think it's very important to get the customer consent to share your data, to access your data, or to delete your data. Is the one item I have heard from that you can delete the customer data. The customer, for me, I can delete my database. Then how can I assure it has deleted? You may be able to keep that copy somewhere. I don't know. That assurance has to be given to the citizen. Thank you.
Thank you very much. I think many experiences he did mention which can be actually applied as well, I believe. And that's brilliant. Thank you so much. Now the next question moves out to Dr. Rohantha now. In your experience, what are the key factors that influence behavioral change when introducing new systems or platforms at a national level, right at the start?
See, it doesn't matter whether it's national or at micro. Everything just goes back to human behavior. I mean, during COVID, you had about 30 to 40% of the people who did their banking on digital. And post-COVID, it went back to 12%. Yeah, I mean, there was so much of studies done by commercial banks in places like Barakapola and, just to see, it's not urban, but semi-urban also. So the question is about how you make life easy for people. Now the question is that if that is not coming out, why would you want to go and put all your data into a national platform? I mean, I was doing the national strategy for the University Grants Commission last year. I did the 5-year strategy. And after the whole program was done, I was asked, give me one strategy that is going to make life changing. And I said, can I just have some data about the kids who are at university? That data is not there. So you're talking about 535,000 kids doing O-level, 337 doing A-level, 177,000 qualifying for university who are the cream of students, of which 50 get picked up to government universities. Now, they are the most intelligent people. There's no record of that 50,000. So if the Indian government comes and says, I want to give your top 50 students in the university system scholarships to go to IIT, there's no data. So now, why isn't that data not being given? Because the system was not accepting it and the benefit of it. So what I said was, if you guys have 159 seats in parliament, right? And if you want to make one change, put the data right. And then I was told that for the last 16 years, different people have come and tried to develop a system of getting student data. And every time it was done, it crashed. Somebody did not contribute. So what it means is that people are wanting to know what benefits they can get from data and how I can make somebody's life changing. So if you don't communicate that, you will never have that. I mean, I'll just give one quick one. Again, somewhere around last year, I got a call from the hierarchy, and I was told, can you guys do the strategy for National Insurance Trust Fund, which looks after Agrahara? So I went to Agrahara and I saw about 100 guys, a lot of noise. So I asked, what's this noise? No, every application that comes has to be sealed. So you seal it and then you move to the next table. So you have 100 guys, noise level. So I said, now what happens? No, now we have to put the data in. So I said, isn't there an easier way to get this data? So they said, no, I mean, we are doing this for the last 100 years. So then I went back and I said, why don't you go to the pensions department? Because every government servant who joins wants to give the data because he wants to get a pension. His whole purpose of working for the government is the pension. So that data is correct. So why don't we import that data here? So that then when somebody is not well, you give your number. You don't need all this. So the question is that the answer to your question, Meryl, is people must understand the benefits of data and what it can accrue. So I am not well, I go to the hospital, let's say Durden's, there's Agrahara branded unit now there. You go there, you get specialized treatment, no, you don't have to make any kind of, key money, not there. So fantastic recognition. But then the question is that, can I be, once I get myself treated and I go out, within 2 days I must pay the hospital. Now, if that happens, that means you have the benefit of data. But let me tell you, whilst this is happening and all the inefficiencies, within 4 days, people get paid, even though it's virtually manual. There's 2.9 billion collections that happen yearly, of which 2.8 billion is paid out. And it's working. So I hope the day that it becomes data-driven, you need to have that kind of efficiency coming out so that then they will say, hey guys, it's worth getting into data.
Thank you very much. And I think the experiences are quite relatable as well. All right. So we have, very quickly, we have a few more questions to go. The next question goes out to Mr. Damien. AI is rapidly transforming, and we all know that we agree upon it as well, especially in the healthcare globally. From diagnostics to pre-detective care, in systems like Sri Lanka, do you see AI as a real opportunity, or are there any risks we need to be mindful of?
So Minal, we have to agree that AI is here to stay. Whether we like it or not, AI is going to evolve. We have to use it. But we have to be very, very mindful, be very careful when we use AI, especially in a healthcare setting. I think Jayasankar would agree on that. So AI could be used in many different ways. One of the ways that I see, especially for healthcare industry, AI could simplify very complicated things. And it could be a patient interpreting one of the lab report, or a doctor looking at patient's all data to get some insights. It could be a patient looking at that his or her history to do some predictive analysis. But we have to be very careful when we use AI, because the result that we get from AI is good as the data that we feed in. So in a system like Sri Lanka, which is fragmented right now, unfortunately, which we are trying to fix. So we need to create those data foundations, a connected system, interoperability again, so that eventually we will get to the point where we can use AI to meet the full potential. And then I think, yeah, of course, AI will help, but we have to be very mindful. Thanks.
Pretty mindful.
So, from the government side, there's a responsibility of the government to introduce some policies for the AI, and other governments like Singapore, we follow the policies what they have implemented. And now second policy document also the release from the Singapore side. And from the last government, they have appointed the committee, more than 65 people in the committee, and the final the report they have submitted. And during my time at the Ministry of Technology, I got the cabinet approval for that one. So thing is that it has to be continued from the government side. There are many entities are there for the private public. There are many entities are using the AI. So there should be some national policy guidelines. It has already done, give the cabinet approval, but it has to be continued.
So the problem about policy and AI is by the time you do your research and you come out with policy, AI has changed. You know, it's moving so rapidly. Now, yeah, but I mean, for example, if you take the education industry, nowadays it's so hard to check a student's assignment because they just put it on Meta AI or Copilot and they get it within like 5 to 6 minutes. The whole answer is there. So now, I mean, I sit on a directorate in one of the education institutes, and I tell the guys at my outset, give me the AI answer. And then I say, okay, now, if you want to put it to Turnitin, right, it tells me that you have got generative AI. So I can't mark you. Now you add value on this. If you give me 80% value on this, you're through. Otherwise, you're failed. So, I mean, so how do you develop policy is the question. You know, and how do you look
it's
at
a different concept. You have different concept. So this is the guidelines. Eventually it is I think increasing, and you may not be able to change anything. But there should be the government side. There should be some the guidelines should be there. If you follow the Singapore one, you may learn something.
I totally agree with you, because yesterday I think that the Singapore Prime Minister did an AI test in Parliament. and he's saying, guys, well, how do you drive in today's world this whole concept of integrity if you don't have a policy? And I totally agree with what he says. And it's very tough.
So much of knowledge, so much of expertise and experience shared. Ladies and gentlemen, I'm sure they deserve a big round of applause for coming here, sharing the proper evidence, the proper knowledge, intricate details, and of course, details which we all can take a long way as well. I'm sure the conversations can go on from topic to topic because we can connect industry to industry with your diverse experience, because we have dynamic panelists seating here at the moment. But sadly, we have a very short time limit as well. So it's time for us to now acknowledge our panelists who have come here. Now, to present the token of appreciations, may I invite Mr. Damien Ponvira to kindly come forward, the CEO of Axon Systems. And ladies and gentlemen, to begin with, gentlemen, you can kindly be seated. That's okay. I know you've been seated maybe for like a minute or two. All right. To begin with the token of appreciations, may I invite our honorable chief guest, Professor Kavinda Dayasiri, on stage for making the time to come here and also for sharing your warm words, well wishes, and also motivating the core team to be a part and to move forward from strength to strength, creativity to innovation as well. A round of applause to our chief guest, ladies and gentlemen, Professor Kavinda Dayasiri. Next, our guest of honor, Dr. Dharmasri Kumaratunga. Thank you so much to our guest of honor and panelists, ladies and gentlemen, Dr. Dharmasri Kumaratunga. Round of applause to him. Come on, everybody, please put your hands together. And thank you very much, Damien, for joining us to present the token of appreciations. Up next, may I invite Mr. Ravindu Jayakodi to kindly join us to present the next token of appreciations to our panelists. Mr. Jayasankar Veerasinghe. Round of applause to our panelists, ladies and gentlemen, Mr. Jayasankar Veerasinghe. And we have one more panelist seating, Dr. Rohantha Atukorala. A round of applause to Dr. Rohantha Atukorala. Thank you so much to all our panelists for taking the time to be seated here and share their expertise knowledge. And also thank you, Ravindu, for joining us to present the token of appreciations. And now we come to a closing note, ladies and gentlemen, and to deliver the vote of thanks, may I invite the CTO of Axon Systems, Mr. Ravindu Jaikodi, on stage. A round of applause to him.
Good evening again, ladies and gentlemen. So as we draw this evening to a close, I'd like to take a moment to express my deepest gratitude to everyone who made this possible. So these kind of events just doesn't happen overnight. It takes time and effort. We are truly honored to have had the presence of our chief guest, Professor Kavinda Dayasiri, and our guest of honor, Dr. Dharmashri Kumartunga. Your presence gave this evening both weight and meaning, and we are deeply grateful. To our distinguished panelists, Dr. Rohantha Atukorala and Mr. Jayasanka Veerasinghe, thank you for lending your expertise and your time to a conversation that truly mattered. We extend our sincere appreciation to the government officials representing the Ministry of Health and the Ministry of Digital Economy. Your support signals something important, that what we are building here is something that is part of something bigger. To our doctors who are here and all the healthcare professionals and industry leaders, entrepreneurs, engineers, innovators, academics, and all the dignitaries in this room, you are not just guests, you are the ecosystem that makes innovations like Healthsync possible. Thank you for being here. A special word of thanks for luminous events, especially to Nipun Piris and Ruchira Ranawaka for orchestrating this evening with such care and professionalism. They took care of every little detail so we can focus on our product. So thank you for that. And if you are planning to host an event like this, please keep them on mind. Also, to our host this evening, Ms. Minel Pereira, you held this evening together with such grace. Thank you. And to our entertainment team, and to the team at BMICH and our culinary partners, the experience tonight was seamless, and that is entirely because of you. And last but not least, to all the people behind Healthsync. First, to the Healthsync team. Every late night, every difficult decision, every moment you chose to keep going, it led to this room. So thank you very much. I'm beyond proud of all of you. And to my fellow directors, our friends and families, you believed in something before there was anything to believe in. So that kind of support is rare, and we do not take that lightly. So Healthsync was built on a simple belief that every person deserves access to their health story. So this is just the beginning. And thank you everyone for being here.
Thank you very much, Mr. Ravindu Jaikodi. Ladies and gentlemen, one more time, we'll display the QR code on the LED screen. Can we have the QR displaying on the screen, please? So that all of you all could scan the code. And if there is any questions, now you have the opportunity to meet the core team, or you can have a chat with your panelists we had today regarding any clarifications you have. And I'm sure the core team will have zero hesitance to assist all of you all accordingly. So this is the QR code. Time for you to grab your mobile phones and scan the QR, and you can download or you can register as well. And with that, ladies and gentlemen, that brings us to a closing note this evening. Thank you so much for being present here today. And to wrap up the official launch of Healthsync, can we give the core team a big round of applause for the strength and courage and confidence they had to take the risk, initiate something that Sri Lanka needs, not just in our country, but that could be implemented, gone overseas as well. And that's the way forward. So all the very best for all your future endeavors as well. And ladies and gentlemen, enjoy the rest of the evening. And thank you so much for being present here. Good night and take care.